welcome. I have mostly been using veratrumalbum in acute cases, mostly in cases of acute gastric troubles. For example, gastroenteritis, diarrhea, dysentery, vomiting, cramps and tenesmus in abdomen, and also in cases of dysmenorrhea. Sometimes I repertorize the case or sometimes I just prescribe on characteristic symptoms. And I have seen amazing results in many cases. Recently, I treated one case, a girl child who is 5-6 years old, and her mother brought her to my clinic. And she was crying with pain in abdomen, in umbilical region, around umbilicus. And pain started suddenly in morning. She woke up from sleep with pain in abdomen, accompanying with sudden urge for stool. And she passed stools only once in morning. And when she came to my clinic, she was perspiring profusely all over the body. And her body was extremely cold and clammy. Clammy means wet and sticky skin with cold perspiration all over the body, and perspiration was continued, and she was looking completely exhausted, sitting on mother's lap and holding her mother tightly. And there were no nausea, vomiting or diarrhea. Just profuse perspiration, cold perspiration and extreme coldness of body with pain in abdomen, and she was crying with pain. This was the case. Then I repertorized the case. I took rubrics, and the rubrics are abdomen umbilical region, abdomen pain umbilical region, abdomen coldness with general, abdomen perspiration with cold, perspiration cold clammy, perspiration profuse cold, perspiration profuse debilitating, then perspiration debilitating and exhausting, generalities discharges secretions exhausting, generalities coldness abdominal complaints in, generalities coldness external, generalities sudden manifestation. These are the rubrics. And in graph you can see here Veratrum is covering most of the rubrics and numbers also. And other remedies are arsenic, carbovage, phosphorus, camphora. Next to veratrumalbum. I gave her veratrumalbum considering the acuteness and suddenness of her complaint. And she felt better with veratrumalbum. Within 1 or 2 days, she became completely normal. I would have given her arsenic carbovage if she had not felt better with veratrumalbum. That would have been my second prescription, but she was feeling better. I was taking her follow-up every 3 hours or 4 hours. And she was improving with veratrumalbum. So I continued the same remedy. So what is the peculiarity of this is profuse perspiration with abdominal pain and profuse discharges, exhausting and profuse discharges is a very characteristic of veratrumalbum. You will not see this in camphor or in cuprum. There is also coldness is present and cramps are present and fainting is exhaustion is present, but profuse discharges, profuse and exhausting discharges is a very characteristic symptom of veratrumalbum. Second case is a case of dysmenorrhea. I treated her a long time ago. A girl, 25-26 years old, she was suffering from very severe dysmenorrhea. And with veratrumalbum, her dysmenorrhea almost disappeared. I still remember her case and I want to share with you, so that you can understand the disease picture of veratrumalbum. In her case of dysmenorrhea, the pain is spasmodic in nature and very violent pain in uterus, in lower abdomen. Either this pain happens just before the menses begins or during menses. Acute, sudden and violent manifestation of pain. Mostly this pain happens in early morning between 5 to 7 a.m. And she wakes up from sleep with this pain accompanying with sudden urge for stool. In previous case also we have seen the same symptom. That girl child suddenly woke up from sleep with pain in abdomen and with a sudden urging for stool. And in this case also we are seeing the same symptom. Wake up from sleep with sudden pain in uterus with urge for stool, and there is a profuse cold perspiration during stool with prostration, exhaustion and sudden sinking of strength. The patient has become so much exhausted that there is no strength left to sit on a commode. But still she somehow manages to sit there, and as soon as she comes out from the washroom, she collapses on her bed. Immediately after passing the stools, because there is no strength left in her body to sit, to stand or to hold the body in an upright position, and hence she suddenly faints down. Vomiting is also there, accompanied with stools. Violent retching with vomiting, and all the discharges are very profuse, vomiting, stools, perspiration, with extreme coldness of body, and sudden sinking of strength, with violent pain. Means you can see here all the symptoms are happening together at the same time. It is like an acute crisis which need an emergency solution. It comes suddenly and goes suddenly, leaving a patient in a very exhausted and prostrated condition. It is like a storm. This episode lasts for an hour or for half an hour, not more than 1 hour. Acute, sudden. And if you read different books, you will find there violent mania and violent delirium. But in this case, mania and delirium are absent, but violent pain is there. Violent pain in uterus. Pain is so much violent that patients scream with pain. Labor-like pain. Sometimes even painkillers and analgesics do not help the patient. All the symptoms are very severe in intensity. Pain in uterus extending to lower limbs. And patient cannot manage or bear the pain by herself, and hence she calls people around her for help. Screams with pain. Pain is so much violent that it makes the patient crazy, maddening pain. Causes her to scream and call for help. She finds herself in a very helpless situation. And there is no energy left because of profuseness of the discharges and exhausting discharges. And once the pain subsides, gradually patient starts gaining her energy, and later she feels chills, shivering and internal coldness. And prostration remains during the first day of menses. She gets her menses immediately after this pain, within 4 to 5 hours or within a day. This is the picture of veratrumalbum, sudden, acute and violent manifestation. If you read in Boerick's Materia Medica, in female section, in italics, it is written there, dysmenorrhea with coldness, purging, vomiting with cold sweat, exhausting menses. We can compare veratrumalbum with camphor and cupramate, but the difference is that leaders in homeopathic therapeutic by E.B. Nash, it is written there, camphor has the collapse with painless stools or even no stool at all. While veratrumalbum has the collapse seemingly as a consequence of the very profuse evacuations of bowels or stomach. This is the difference between camphor and veratrumalbum. In cuprement also you will see violent cramps, spasms, violent convulsions. But what is the difference between cuprement and veratrumalbum is in veratrumalbum the discharges are very profuse and exhausting. Coldness of body is present in all these remedies, three remedies, camphor, cuprum and veratrum. But the profuseness of discharges and exhausting discharges is very characteristic of veratrum with violence. This is the case of dysmenorrhea. Now let us talk about main rubric. The main rubric of veratrumalbum is despair position of social. The whole state of veratrumalbum revolved around this rubric. Despair means sudden loss of social position, is a causative factor for stress in their life. He is very concerned about his position in society, his status in society. So society is always related to a group of people. It could be a group of students learning in a same class, or it could be a group of employees working together in a same institution, or it could be the person's neighbors, person is living with in a society, in a flat system, or it could be any social group person is connected with. When a person is suddenly and forcefully thrown out of a group by leader, boss or by group members, will trigger his emotional state. Sudden, forceful exclusion from a group is a veratrumalbum, theme of veratrumalbum. Veratrumalbum belongs to Lily-Flory family, and the sensation of Lily-Flory family is forced out, excluded, oppressed, left out, neglected, not interested in me. When a person is suddenly, forcefully thrown out of a group, this is veratrumalbum. Sudden, violent exclusion from a social group. Then what kind of exclusion it is? It is not in a very humble or polite way or in a private place, in a private space. No, it is in a very rude way, in a very dishonoring way. Very loud in front of all the members of the society. That will damage his pride, his honor, his status in society. And that will also affect his self-esteem and position in a society. Feeling of undervalued, disrespected, and loss of honor. In Phatak's Materia Medica, in aggravation, it is written there, aggravated by injured pride or honor. In veratrumalbum, somewhere in their life, they have gone through lot of failure, insults, mortification. Person feels that he is unwanted, neglected, and he is not a part of a community. For example, a person who was very rich and one day suddenly he lost everything, and now he has become very poor, like a beggar. And now no one asks him in his friend circle. One who once lived in a limelight, received so much attention and value from all the people, now nobody asks him. Nobody look at him. Nobody consider him as a part of a group. This kind of feeling or situation. This situation can happen with anyone. It can happen with any student, a student who is very brilliant, a high ranked student, and suddenly one day teacher throws him out of the class or punish him in a very dishonoring way in front of all the students. Or for example, this situation is very common in our society. The husband forcefully throws her wife out of the house in front of all the neighbors and members of society. And when, for example, when an employee is suddenly or forcefully thrown out of the institution by boss, this kind of situation. In this situation, person suddenly feels that he has lost his position, his status, his pride, his dignity, honor, and he feels very left out, alone. He does not feel that he is a part of anything, a part of community. While case taking, if you try to stress out the past situation in patient's life, you will get this kind of situation or feeling. We all are humans, and humans are social beings. This society is created by humans, and hence you will encounter this kind of situation very often in your practice, in your life. This is veratrumalbum. I have shared with you my clinical experience, my experience in my life, and I hope it will help you in your life, in your practice. Thank you for listening.